Cameron, party looked at Gilmore.
Cancorla, the Taoiseach in his reply to Deputy Kenny says that the Minister for Health says that the women in Portlaoise are at the centre of this issue. She has a rather unusual way of showing it. She circulated a motion yesterday for debate here in the House tomorrow, which welcomes the report and praises herself largely, makes no mention at all of the women in Portlaoise, no mention of the 9 women who were misdiagnosed with cancer, no mention of the 101 women who were called back for mammograms, no mention of the 143 women who were called back for scans, no mention either of the conclusions which were drawn in the reports. Dr. O'Doherty's report, which says that the rate of misdiagnosis in Portlaoise was 6 times higher than the best diagnostic centres, and Mr. Fitzgerald's report, which says that the decision-making process was fragmented with insufficient clarity about decisions, who was making them, why they were being made, or when they were signed off, and which went on to talk about systemic weaknesses of governance, management and communication. That's a dysfunctional organisation that Mr. Fitzgerald is describing. That's the organisation, the HSE, that your government established to run the health service. That's the organisation that you came in here and your Minister for Health came in here and guillotined the Dáil debate because you couldn't get it established quickly enough. And it's manifestly clear now that it is not working. And when you're asked about it today, you say there are issues to be addressed. There's to be a review, and that we must reduce the bureaucracy. We've had 11 years to do all that. And what we've ended up with is a health service and a health organisation which is worse than what we had. Now, Taoiseach, I'd like to know, instead of talking about issues to be addressed and reviews and so on, what is going to be done about it? Let's start at the top. I agree with Deputy Kenny. We need a health service executive that fulfils all of those 5 functions. We also need a Minister for Health. We need a Minister for Health like a Noel Brown, who has a passion and a commitment to public health, who sees curing and caring as a public service and who doesn't see medicine as an opportunity for business. That's what we need. These problems were notified to Minister Martin 6 years ago. Have you asked, since these reports came out, Taoiseach, what conversation or discussion have you had with Minister Harney and with Minister Martin about these 2 reports? Do these ministers answer to you? Did you ask them to consider their position? I think in most other countries, an appalling litany of mismanagement and bad leadership, which is what we've got here, would be responded to with one only. Did you ask them to consider their position? What are you going to do about the HSE? We see reports this morning that the government are reported, at least, to have been considering going back to some kind of regional structure, and concluded, as the government always does when it's faced with a difficult problem, that it will bring in consultants. So what is the government going to do about the HSE? Are we going to allow it to continue as it has been in this kind of dysfunctional manner that has been described by Mr. Fitzgerald, which will inevitably lead to other people having to suffer the same kind of fate and problem that the women in Portlaoise had to suffer?
Gilmore.
I don't think that's a good enough answer, Cancorla, not after 11 years. What I understand the Taoiseach to be saying, what he's concluding from the Portlaoise reports, is that the problem was in Portlaoise. It was the people in Portlaoise who weren't talking to each other. The valiant efforts that he and his ministers were making to reform the health service were all being resisted by people here in the House and elsewhere. No mention, of course, of some of the people behind him who were much to the fore in it. Taoiseach, you're suffering from a bad dose of BSE. Blame somebody else. That's your problem. And you're constantly, every problem that you're confronted with, you will find anybody to blame but ministers in your own cabinet. Now, the way you described Portlaoise, that nobody was talking to each other, that they weren't meeting, that they weren't communicating, If it was a garage you were describing, you wouldn't bring your car to get it serviced in. And after 11 years in office, that is the state of the health service that you have presided over and that you're offering to the Irish people.
Correct.
That you're saying to people that this is the service that they're expected to get. That this is the kind of, if they feel something wrong with them, they want to go for a test, that this is what they have to meet. Into institutions where people aren't talking to each other, where there isn't communication, where nobody knows what the other person is doing, where nobody seems to be accountable to anybody else. That's not a functioning health service. That's a mess. And after 11 years, I think that we need something a little bit more clear from government and a little bit more definite than coming in here, shrugging it off and saying, well, we're going to make a fresh start. You've had ample opportunities to make a fresh start. And trying to say that, well, that was 1983 and that was before the HSE, as if somehow you were not responsible for what was there in 1983 when you were already 6-7 years in government at that stage and had gone through, I think, was it 2 ministers for health by that point, is no excuse either. You've presided over this. This monster, the HSE, which you created, this was your solution to it. This was what was going to solve the problem in the health service. It's made it worse. And all you can now do is plead that you want to make a fresh start and spend another few million of taxpayers' money bringing in consultants to look at it again.